Hello, everybody. Thank you so much for joining us today for our webinar. Our webinar today is on menstruation and ASD. And Flo Doesn't Discriminate. Your presenter today is Keely Lundy. Before I present Keely, I just want to go over a few key reminders to please remember to mute your sound throughout the whole presentation. And if you're comfortable, you can turn on your video, and we'll be having a question and answer session about 10 to 15 minutes towards the end of the hour. So if you have any questions you would like answered, feel free to use the chat box or jump in towards the end. Like I said, your presenter today is Keely Lundy. She is a second-year doctoral student within the school psychology program at the University of Utah. She is from Nashville and spent her college career in the Deep South, aka Mississippi. Outside of school, work, and research, Keely spends her time running with her pup and house projects with her husband. She hopes to one day actually like running and finish all the house projects. Thank you so much for being here today, Keely. We're very excited to have you, and I'm going to go ahead and turn it over to you.
Awesome. Thank you, Annie. Let me share my screen. Okay. As Annie said, my name is Keely Lundy, and I go by she, her pronouns. In addition to being a student at the University of Utah, I work for the Huntsman Mental Health Institute, or HOME program, as a behavioral technician, where I provide support to individuals on the autism spectrum for a variety of behavioral health concerns. Since working at the HOME program, I've been introduced to the extreme and sheer lack of resources available for individuals on the autism spectrum, their caregivers, educators, and service providers to help prepare for and manage periods. I've been one of those service providers. Today, you'll be hearing about the background to my research, as well as some important topics to consider when working with persons on the autism spectrum who expect to or are currently menstruating. Now, research is always changing, so what I'm saying may not be applicable 3 to 6 months or so, and I'm by no means an expert. So it's important for myself and all of us to stay up to date. And if you have other related or more current information than I do, feel free to share back channel. I'd love to have it. As you can see in the title, menstruation or Aunt Flo doesn't discriminate. This means every body assigned female at birth will experience periods. So there needs to be equitable resources available to support all of these individuals. And before we begin, like Annie said, we'll have a Q&A period, pun intended, at the end of the webinar. If you're like me, where I forget everything, if I don't write it down, feel free to put the questions in the chat and I'll try to address them at the end. So let's get into what we'll be covering today. And first, we're going to be discussing the importance of inclusive language use with menstruation topics and the recommended language as proposed by research. Second, we will look at neurotypical and neurodiverse experiences of puberty, specifically those on the autism spectrum. Third, we'll look at menstrual hygiene management, what it means now and historically, and ways to increase autonomy and comfort for those on the autism spectrum. Fourth and last, we'll review some resources I have found to be super impactful in my learning about this topic and have informed both my research and practice. To get started, we're going to do a quick activity or a poll. And as we get set up back channel, I'd like you all to either pull out your phones or go to this link on the screen, which I'll also put in the chat. So please send in a word or two on what comes to mind when you think of menstruation. When you're putting in responses, if it's more than one word, put a dash between the words to keep them together. It's a little funky that way. But I'm going to take off my screen and have Annie screen share. Okay. So what comes to mind when you think of menstruation? Also, the chat has the link. Someone put in the chat, Aunt Flo, pain, That's real. PMS, products, puberty babies. Oh, we're getting a ton. So discomfort, cramps. In the chat, we have cramps, smell, bloating, grumpy. Awesome. Carb. Yes. Awesome. Thank you guys for some of your responses. All of these terms are relevant for our peers on the autism spectrum. So we're going to be addressing some of these things. I appreciate your participation. Let's get back to the PowerPoint. Okay. So now we're going to talk about our first item on the agenda, or inclusive language, and why it's important and recommendations on incorporating it into your lives. As many of you know, gender identity is a person's sense of their own gender, which may or may not coincide with sex assigned at birth. And while cisgender women are the majority of menstruators, they are not all. And when considering menstruation, we must also consider the perspectives and experiences of those who identify outside the binary norm, such as transgender, non-binary, gender fluid, genderqueer, agender, two-spirit, and bigender individuals. Many researchers will use the umbrella term transgender or gender diverse to label those outside the cisgender norm. And moving forward, this is what we will also use in the presentation. But in your own practice and everyday life, research may not be applicable for all clients and students. Make sure you ask how the person likes to be identified. So why is it important to use inclusive language? Outside of 1.3% of the population identifying as transgender or gender diverse, there can be serious negative effects to not including their perspective around menstruation, such as many will avoid using public restrooms while menstruating to the detriment of the health of their bladder and kidneys. They may avoid these places out of fear of being outed, if seen carrying pads or tampons. Sounds made unwrapping hygiene products in the bathroom stall or discarding used products in the public bathroom's trash can. They may feel unsafe due to potential threat of physical retaliation if outed. Another adverse effect of non-inclusive language use and attitudes would be the lack of appropriate and timely healthcare due to anticipation or experience in the past of negative attitudes from providers and a lack of understanding of a patient's body. So this leads to a lack of menstrual knowledge or treatment of menstrual disorders for transgender or gender diverse persons. To summarize this slide, inclusive language has huge effects, and it's critical to incorporate it into your own personal and professional practices around menstruation. So now I'd like to discuss how this applies to those on the autism spectrum, who are, for many of us, the majority population we work with. There have been several studies that looked into the question of how many people on the autism spectrum also identify as transgender or gender diverse. The largest of these studies was conducted by Warrior and colleagues in 2020, where they surveyed 641,860 individuals. From this, their largest finding was that transgender and gender diverse individuals are 3 to 6 times more likely to have autism than cisgender individuals. This is a monumental statistic and emphasizes the need in our and related fields for a greater education on and training to work with this population. In addition, transgender and gender diverse individuals reported more traits associated with autism, such as sensory difficulties, lack of pattern recognition skills, and lower rates of empathy. What we're finding in recent research is that females assigned at birth don't present in the same way that males assigned at birth do for autism. So we don't know much about how ASD presents in transgender and gender diverse individuals as well. So it's likely that many persons, such as females assigned at birth, transgender, and gender diverse, are being under-identified, which translates to this rate of 3 to 6 times being an underestimation. So greater research needs to be collected in order to get a true and actual count of ASD among this population. This same article looked at why is this higher rate occurring? And their research showed that people on the autism spectrum are more likely to be less influenced by societal norms and rather actually represent who they authentically are every day. To summarize the last two slides, not all menstruators are women, and there's a higher likelihood that the clients or students we're working with on the autism spectrum identify outside of the cisgender norm. Now more than ever, we need to be equipping and encouraging ourselves and others to use appropriate and inclusive language. All right, resources. You're going to get a ton of resources throughout this presentation, but this is an infographic that I found that was, I think, put forth by a university, Querieds, I think is how it's pronounced. They made a flow chart on how to, like an easy way to incorporate inclusive language in public health messages. So does the person menstruate? Yes, then they are considered a menstruator. No, they are considered a non-menstruator. And they also have good examples on inclusive language on related topics, like instead of becoming a woman, you replace it with starting puberty. Instead of women's health, you're going to say reproductive health. Women, replace it with people. So this has been really helpful too for me, for my research and for my conversations. If you have clients, students, or friends seeking help in regards to healthcare or are wanting qualified and accepting professionals to work with, I recommend the Transgender Health Program, which is a national program, but it's through the University of Utah here. This program started in Boston in 1971, and its mission was to serve all individuals in their local community because they believed that healthcare is a right and not a privilege. Also, here's a list of inclusive menstrual products and companies that provide comfortable and equitable products. The menstrual business in general has started to move towards greater inclusivity in their product development and advertising, which is a really great thing. To highlight on this first product and company, Thanks, my colleagues and I are doing a study this summer that's going to be looking at the acceptability of Thanks products for kiddos on the autism spectrum. So pretty excited about that. Moving forward, since menstruation is not strictly a woman's health issue, we'll be using terms that incorporate all perspectives in every body, such as menstruators or people who menstruate or persons who have periods. And I recommend that you all take this language forward with you after this presentation. Okay, so now we're going to be getting into puberty and autism spectrum disorder. We're going to discuss some common experiences of those on the autism spectrum during this transition. But I first wanted to start with a video with some perspectives of care providers about their kids on the autism spectrum during puberty. Please let me know with a wave or something if the sound is not working.
Young people with disabilities may have special needs in a range of different areas, but in all likelihood they are going to go through pubertal changes at the same time as everyone else, and the range of pubertal changes we're talking about are both physical changes but also the emotional changes and the development of sexual interest.
When Andrew went through puberty, that was very hard. Because he did not understand what was going on with his body. How do you explain it?
Basically, Tash was a little girl one day, and within a couple of weeks she was fully into puberty. It was such a shock for her, and she had this amazing bodily growth very quickly. If it's hard enough for regular children who can express themselves and do understand the world to cope with their feelings and their fears and their anxieties and the confusion, then you can imagine how frustrating and confusing it is for an autistic child who, you know, cannot express themselves, doesn't understand the feelings.
When I went through puberty, I didn't know what it was all about. It wasn't explained to me, and I didn't, again, comprehend what it was all about. So for me, it was just enduring pain and trying to comprehend why breasts grow on women and why men become like they do. It's very difficult for a person with ASD to comprehend puberty.
Young people with ASD are often anxious about changes and can get more anxious about things. Therefore, talking about puberty before it happens, warning them that these changes are going to happen, making it quite clear that asking questions is fine. There's no question that will embarrass me, is one of my lines. And it depends on how your child likes to learn. If reading a book is going to be the best way to talk about your body is changing, but you can likewise find sites on the internet that talk about bodies changing. So adapt to what the best way of approaching things are from your child's perspective to tackle the issue.
When Alex started going through puberty, it was quite funny because he kept saying he wanted me to take him to the doctor because he wanted to get his voice fixed, because he didn't want it to go low. And I think because deep down he knew it, that you can't stop it, but he was trying to, you know, tell me that he didn't want it to go lower. And I said, look, there's nothing you can do about it. Your voice is breaking and that. So that was probably the first thing that he started commenting about. He did comment a few times about, you know, not wanting to get hair in different places, but, you know, I just sort of just say, no, everyone gets it. There's nothing you can do about that.
We did experience quite a regression. She really did stop expressing herself in any which way. She became so anxious and so frightened. We had to rewind the clock and go back to like lots of visuals.
One of the challenges.
Okay, so we're not going to watch the rest of the video, but it's they go on to talk a little bit about other people's experiences with puberty and some really great strategies, which we'll touch on later in the presentation. But as mentioned in the video, persons with disabilities are very likely to go through puberty at the same time as their neurotypical peers would, with the same developmental pattern. So you can expect similar physical, emotional, and sexual changes to occur. Some children on the autism spectrum had trouble understanding these changes, as reported by caregivers that were brought on by puberty, and then even greater difficulty expressing the needs or concerns. One parent mentioned that there was a regression in skills, an increase in anxiety as well. It can be helpful, and I'm going to reiterate this throughout the presentation, that you can never start too early in education about puberty, especially like before puberty starts. You want to start talking about puberty, as well as using some of the strategies that they mentioned. So now now that I'm telling you to start earlier with the education, when do you start is the next question. And unfortunately, that's a tricky question. There's been extensive research on the timing of puberty for youth, and it's been shown to be greatly affected by socioeconomic status and biobehavioral factors such as genetics, endocrine systems, and environmental situations. It's common to see a difference in the age at which puberty starts across cultures as well. But specific to the United States, research has shown the onset of puberty to be decreasing across youth, where the age of onset for menstruation is around 11 or 12 years of age. It's normal to begin anywhere from 8 to 14 though. If starting before age 8 or after 14, it's recommended to talk with an OB/GYN or the child's doctor. In a study conducted by Corbett in 2020, menstruators on the autism spectrum tended to start puberty 9.5 months earlier than their neurotypical peers, translating to an earlier menarche, or first period, first regular cycle. And historically, there's a greater risk for mental ill health for those who start puberty earlier than typical due to greater emotional reactivity, cognitive imbalance, and incongruence with physical maturation typical of this transition. Also good to know, menstruators are at a greater risk for depression as well. Like mentioned in the video, youth, those on the autism spectrum in particular, need to be better prepared, educated, and supported earlier, especially as we're seeing that they start puberty 9.5 months earlier than typically developing peers, for puberty. And we're going to discuss some of those strategies to help with this in a few minutes. Let's go into some issues related to puberty for those specifically on the autism spectrum. Big disclaimer, there is very little research focused on the pubertal experiences and autism. However, the typical domains of impairment with ASD can be used to better understand and predict potential issues during puberty. So autism spectrum disorder is characteristic of two big criteria, which is impairments in reciprocal social communication, meaning they may have difficulty starting conversations, responding appropriately to other social approaches, or changing behavior based on unspoken social rules. They will also present with like a repertoire of restricted, repetitive, and stereotype thought and behavior. So due to the spectrum of presentation of ASD, there is significant divergence with pubertal issues. However, there are some common and intense concerns that have been researched within this group when compared to typically developing peers. First of which, menstruators on the autism spectrum struggle with adapting to change and desire sameness. So many will respond poorly to the transition into puberty and demonstrate what we like to say inflexibility with change. Others, such as care providers and service providers, may see an increase in behavioral outbursts and irritability at this time. Second, many will engage in greater social withdrawal and are at an increased possibility of peer rejection. This is maybe where the mom in that video was talking about that regression of skills, potentially social skills. Peer rejection can occur or is more likely to occur at this time due to the increase in social complexity and demands of adolescence, combined with the difficulties with social skills characteristic of autism. Third, they are likely to present with complaints related to mood and behavioral abnormalities during and prior to menstruation. Abnormality here is defined as any change in emotional or behavioral state causing a disturbance in daily activities. Fourth, it's likely that after menarche, again, that first period or regular cycle, they may be less on the go or hyperactive, which may be considered as a positive in some cases. Good to be in the know. And then finally, menstruators on the autism spectrum are more likely to suffer from some of these gynecological concerns, such as menorrhagia. And I did have to look up how to say these online. They're kind of hard to pronounce, but menorrhagia is the abnormally heavy bleeding at menstruation, and also dysmenorrhea, which is painful menstruation localized in the abdominal region. Irregular bleeding, meaning the duration of a cycle varies, as well as hygiene issues, such as handling the increased demands of hygiene needs that start through puberty and continue throughout the lifespan. So while there are some differences in changes due to menstruation, these are often intensified if menstruators have more significant cognitive impairments, including increased self-injurious behaviors, mood and emotional dysregulation, sensory issues, and repetitive behaviors. It's important to know and understand the perspective of menstruators on the autism spectrum. And this is one of the biggest lacks of research right now. Robin Stewart is kind of a pioneer on the perspectives of those on the autism spectrum with menstruation. She's a person on the autism spectrum herself and author of a really helpful book that I'm going to talk about later. She collaborated and created a survey which asked about the menstrual experiences of neurotypical menstruators, as well as those on the autism spectrum. For menstruators on the autism spectrum, periods were considerably more difficult and filled with overwhelmingly negative experiences, especially exaggerated sensory issues and intensified executive and emotion regulation problems. Many of these negative experiences had some serious consequences, such as shutting down, withdrawal, and heightened anxiety, resulting in reduced participation in work, social, and community life for these individuals. And setting up for our next section, menstruators on the autism spectrum struggled with understanding what was normal in terms of menstruation, such as the menstrual cycle length, the amount and duration of flow, mood, behavioral, and bodily effects of menstruation. and what was normal for others on the autism spectrum. Robin's study emphasizes the need for greater research in this area so as to understand the cycle experiences better for those on the autism spectrum. All right, education. We've been talking enough about it. Let's get to it. I reiterate that it is never too early to start talking about puberty and our menstruation. However, many caregivers and service providers and educators may feel a little uncomfortable with broaching the subject as historically it's associated with sexual intercourse. In the study conducted by Robin Stewart in 2020, their survey asked how menstruators first heard about periods. And as can be seen in this left-hand column under autistic, the majority of menstruators heard it through parents and caregivers, followed by school personnel. And I consider this really, really good news, as it's showing that the topic is beginning to be approached more, and hopefully through trusted sources close to the individual. But the question remains, what and how to teach about puberty and related processes like menstruation? So what to teach? By age 8, caregivers should have established these foundational skills among youth to make the puberty experience more successful. So these are kind of the foundational skills, the setting stones for greater education later. The first of which is following guidelines for public versus private. That includes public versus private body parts, places, language and conversations, activities and behaviors. Also participating in hygiene routines, independently or with support. Before puberty, this may include toileting, bathing or showering, hair brushing, foot care, or dressing. Respecting others' privacy is another foundational skill. With this, we need to discuss what are private activities at that age, which would be changing clothes, using the bathroom. The best way to teach this would be the closed door rule, and teach them to knock whenever that door is closed. And then the final foundational skill would be understanding rules for personal space and touching, such as respecting others' space when interacting with them, demonstrating appropriate touch or affection with others depending on their relationship with them, and then appropriately communicating their comfort level with others who they're interacting with. If interested, here are some curricula that build off of these foundational skills and are considered holistic in their approach by the Sexual Health Equity for Individuals with Intellectual Developmental Disabilities, or the SHEED project. I'm not sure if I pronounced that right, but this organization has been critical in their research to determine appropriate sexual health education resources, as well as guidelines for communities. The first of these curricula, I took the top 3 in the research program that they had. And the first of these we have bought through our lab, and members should have access soon, which is really exciting. But most of these curricula will also have the answers to the questions posed by Stewart's study and strategies on how to teach them as well. So now we're going to do another activity or discussion poll. And as we get set up back channel, I want to cover how to teach. So you want to make sure that you're using the same language across settings and persons, as well as keeping it unambiguous. So menstruators on the autism spectrum might not understand these more abstract or code names kind of terms around periods. So it's super important to maintain this consistency and explicitness for terms involving anatomy and pubertal changes, especially during this new experience or this transition into puberty. So for our activity, we're going to do another poll, and I'd like you all to send in names you've heard people use to call their period. I'll leave this up for a quick second for you all to get a QR code. Okay, I'm going to stop sharing. Friend. I like it. That's kind of like a personal one. Time. Yeah, friend time. Yeah, and I forgot to remind you guys, if it's more than one word, put a dash. Full moon. Yep. Shark Week. That was a big one that I saw. And some of these might be a shock to you guys, but There's some crazy ones. Red wedding, visitor, red wave. Awesome. That time of the month. Yep. Guest. Okay. Well, thank you guys. I'm gonna turn it back to the slideshow. Okay, thanks for participating. This is what I got after reading a ton of BuzzFeed articles and doing my research, air quotes. But there were some that you guys reported, but some other ones that people use, like Downton Abbey. Shark Week was a big one that I saw too. Red Wedding, Crimson Tide. Vampire Tea was very new to me, and I feel slightly uncomfortable with that one. And then exclamation point. I thought that was a great one. Rather than period, it kind of encompasses that whole experience. Anyway, this exercise was meant to kind of demonstrate that there's a lot of different names for periods, right? And throwing them about when someone's learning about what a period is and what they're going to be going through, it's not the time to be throwing out Shark Week or Red Wedding. They just might not get it, especially our kiddos on the autism spectrum. Okay, so now we're going to get into menstrual hygiene management, or MHM. And this has been the main focus of mine and my colleagues' research. And what is it exactly? A global definition that's commonly referenced and was put out by the World Health Organization and seems to be most comprehensive to me is using a clean menstrual management material to absorb or collect blood that can be changed in privacy as often as necessary for the duration of the cycle, as well as understanding the basic facts linked to the menstrual cycle and how to manage it with dignity and without discomfort or fear. So when we boil it down, it's using the appropriate products and understanding the basic facts of menstruation and how that will impact somebody. What I think is most important in this definition, though, is managing their cycle with dignity and without discomfort or fear, which is a goal we should have for all menstruators, especially those on the autism spectrum. All right, diving into the backstory of menstrual hygiene management. As mentioned earlier in my presentation, there is an extreme and just sheer lack of research on this topic related to persons on the autism spectrum. And why is that? Well, we can thank the eugenics movement, which started in the 1900s. Eugenis means well-born in Greek and refers to the breeding among the most fit in an attempt to produce the most desirable offspring. From the eugenics movement came the Holocaust, as we all are familiar with. But who was among the undesirable category? Well, many people, but a big majority of them were individuals with disabilities and mental ill health. In the United States, most states had legalized the sterilization of these individuals, resulting in 60,000 people documented being involuntarily sterilized. In Utah, as can be seen on the graph, close to 800 individuals had been sterilized by the year 1963. And it wasn't until 1942 support for reproductive freedom was voiced and the Supreme Court ruled it as a fundamental right for all. However, you might ask, but they kept sterilizing people until 1963. It wasn't until the 1970s, several years after the Supreme Court ruling, that federal funding for these sterilization programs was terminated. So that's why we have such a big number there. Since then, we've been playing catch up with research on evidence-based practices and strategies in the menstrual hygiene management field for those with disabilities. Even more, there have been other holdups with research, such as cultural factors, where sexuality or reproductive education are considered taboo to discuss or to teach. Also, many people do not see the need to provide education to on sexuality or reproductive health issues to those with disabilities, as they weren't seen as sexual beings. And so it wasn't until recently that we're seeing another wave of advocacy, but this time for the education of all individuals of all ability levels regarding sexuality, including menstrual hygiene. So though research is limited, there are strategies which have shown to provide positive results in increasing independence towards managing periods for those with disabilities. And that's what I'm going to be talking about for the rest of my presentation. It's important to consider that due to the privacy and safety concerns in teaching this skill, it's recommended that caregivers be the ones to instruct and practice period management with their menstruator. If needed, educators, service providers can provide greater training and instructional materials to those caregivers. Also, when choosing what strategy to try, always keep in mind the menstruator's comprehension skills, as some may be more appropriate than others. So this first one I'm going to talk about is visual supports, which refers to using a picture or other visual item which shows the steps involved in a specific task. Visuals have shown to help those on the autism spectrum know what to expect, as well as reduce anxiety. So on the left here, I have visual supports as pictures or image visuals. It's where still images are placed in a pattern of sequences, which can be made using Google images or real life pictures if the child's comfortable. These can be placed in the bathroom to help prompt next steps in completing a task such as what's in this visual support, removing or replacing a sanitary napkin. Another type of visual support would be using videos, which have shown to be successful in teaching functional life skills such as safety, cooking, caring for a pet, among others. Videos can use different models such as real life or video animation. And when making that decision, it's important to consider what would be most salient to the menstruator themselves. Here on the right is another, or is a teaser for our intervention this summer that my colleagues and I are doing, where we are going to be teaching some kiddos on the autism spectrum how to independently remove and replace a sanitary napkin using this video animation technology. Another strategy to help increase autonomy would be social stories. And this strategy is meant to explain situations and teach appropriate behavior. It's historically been used to teach socially related behavior mostly, but can be applied to period management as well. If you're creating your own social stories, make sure to write it in the perspective of the menstruator. Keep it simple, a few sentences. This one on the left may be a little bit too much for some kiddos, but make sure you provide explicit details about the actions or behaviors expected in a particular setting. For example, removing and replacing a sanitary napkin in the bathroom. Really emphasize that it's in the bathroom. This strategy can also be helpful in preparing someone for managing periods outside the home as well. Another teaser for our study on the right, this is a video we've titled About Menstruation, which is a social story of sorts that goes over topics related to menstruation, like where a vagina is located, what happens on your period, what you use for periods, dirty versus clean pads, signs you're going to start a period, as well as like healthy versus unhealthy signs during your period. So another little teaser. And my third increasing autonomy strategy would be menstrual calendars. And these can help a menstruator keep track of their cycle and update it on where when their period is going to start, rather than guessing. At first, a menstruator may need help learning how to use these tools, but these are just some one app and some of the templates that are out there. There's a ton, and these were introduced to me by some of my clients. Another big tip in teaching and mastering skills for menstruation on the autism spectrum is repetition or practice. So often it takes more attempts for them to master a skill, and some skills may not immediately generalize to other settings. So caregivers, educators, service providers should practice the desired behaviors, so managing their periods independently, using the strategies in locations that the behavior is expected to occur. So not just practicing in a personal home bathroom, but also practicing maybe in the locker room at school, which can hopefully be done with working with one's school administrators to try and do it after school hours with the menstruator, and practicing it in the locker room. So now I'd like to talk about increasing comfort and some strategies for that. I'll ask you all a question, but how do we all learn what's comfortable or not? And that's exposure. We figure out what we like by exposing ourselves to other strategies or products. And there's a ton of products out there. There's menstrual cups, non-reusable pads, cloth pads, tampons, period underwear. We need to expose our menstruators to all of these things to figure out what they like and what they're comfortable with. Not to mention that there's so many different brands in each of these products, right? And all of us have a preference for a certain brand. On the right is this website that I'm going to talk about some more, but they provide videos on topics like menstruation, puberty, and relationships. And this video in particular talks about the products and what they are and how to use and so on and so forth. So to increase comfort, caregivers can bring the menstruator to the store with them when they're purchasing their products and talk with them about the different products that are available and why they might like a certain brand and why they might not like one. Educators or service providers may not have as direct a role in this, but can be talking with caregivers about exposing menstruators more to products and providing some of those additional educational materials. It was actually my clients who introduced me to period underwear. So there can be mutual benefits in having these conversations with caregivers and menstruators. Before we get into resources, just the overall goal of exposure is to normalize periods as much as possible, which will hopefully make menstruators more comfortable with the entire experience. Okay, resources. This is what I promised. These are just some, to name a few, that have been really critical in my growth on this topic. And I've starred the ones that I found to be most helpful. The first of which under books would be that Autism Friendly Guide to Periods by Robin Stewart, the researcher that I previously talked about. It's very kid-friendly and helpful. Taking Care of Myself, the second book, is a curriculum more for caregivers or service providers. Just kind of gives them a guide and some lessons and materials. Educational websites, Sex Positive Families is really awesome. It gives a plethora of resources on just so many topics, but they have some really good ones about menstruation and puberty as well. Amaze Videos, like I showed a little bit earlier, has videos on periods, reproductive health, STDs, sexuality education in kid-friendly terms, and are actually pretty fun to watch. So, and then this next one that I started under educational websites, ASD Sex Ed, has been really awesome in my research on providing awesome curriculums to inform our trainings. So highly recommend that. And then podcasts. Podcasts are my favorite form of or modality to ingest information. And this first one, LOMA, which stands for Land of Milk and Honey, is hosted by a parent of a kiddo on the autism spectrum, and she brings in a ton of experts in the field of autism on different topics such as financials, living independently, literacy, behavioral issues, and she talks a little bit about sexuality education and menstruation. And then the second starred podcast is Sex Ed for Self Advocates, which is a podcast on a few different sexuality education topics that's hosted by persons with disabilities. So those are just some that have been super helpful. And now that concludes my part of the presentation, and I'd like to open it up to questions. And I'm gonna take it off screen.
Thank you, Keely. That was awesome. Like Keely said, right now is the question and answer portion of the presentation. So if you would like to submit a question, feel free to use the chat function or feel free to just jump in.
Do you have any recommendations for like 9-year-olds on the autism spectrum who are about to begin puberty and who are just like kind of emotionally immature?
For them or for like caregivers or service providers?
Probably all, because
Okay.
mom also has autism and is very uncomfortable with this process, and so it's kind of been put on others, and so it's kind of it's a new like area of that I'm not sure what to do with. So
Yeah, no, I totally get it. Yeah, I think Annie will be able to post this PowerPoint so that you can have access to the resources. But I really recommend the Autism Friendly Guide to Periods. The child can have that, or service providers can read it and kind of go through it. But I always think videos or technology is a little bit more exciting and engaging. So Amaze has been amazing. Just with the content that they're putting out, they're putting out so much new content all the time. So it's a really good resource to maybe show a video each session with the client, have a discussion, and maybe have an activity. And that ASD Sex Ed website, I believe, has several activities that you can do, and it has the different ages as well. So those are some free, except for the book, resources. And for mom, I think just maybe, I don't know if she likes to read, but I read a book recently that was just like for caregivers. And so I can email that to you if you'd like, if mom wants that. So
that would be great. Thank you.
Yeah, just put your email in the chat and I can email you that link. I didn't put it in the presentation. So
not a problem. Thank you so much.
Yeah.
Yeah, I could definitely post the presentation slides on our lab website, which I'll talk a little bit more at the end. And there was a question submitted through the chat by Tanya. Is there a recommendation to hormone pills to help provide more scheduled and predicted periods?
Yeah, and that's like I guess a personal preference on the perspective of the caregiver as well as the child, but it is recommended to do hormone pills or like birth control type of things to kind of regulate those hormones. But yeah, so they term that as menstrual suppression in the research, and it does tend to fall under menstrual management, but it is recommended, but it's based on a personal or subjective each case scenario, I guess. And to always speak with the primary care provider or the OBGYN to get better recommendations.
There was a question that was submitted through the RSVP link, so I'll just read that out really quickly. Is menopause for autism spectrum, for persons on the autism spectrum disorder studied? Does it occur earlier or later for those persons?
Yeah, I looked into this topic, menopause and persons on the autism spectrum, and there is one article, only one in all of the research land. And the article was put out actually last year. So there's no research on the onset or the timing of when menopause will happen with this group, but they did say that it's very similar to menstruation, that the experiences of these persons on the autism spectrum is pretty overwhelming. And unfortunately, there's even less support available for these individuals because it's just not researched. So menstruation is starting to be like more of this hot topic. But I agree, I think menopause needs to be researched for sure. So yeah.
That's shocking that there's only one article.
I know, it was insane.
Yeah, that is crazy. But I think it does speak to the fact that the older you get, there's like less layers of support. There was another question that was submitted through the chat. by Alex. The video you shared was revealing in terms of offering perspectives from both caregivers and people who have autism. Given that the video was produced in Australia, I was curious which countries are putting forth the most recent and/or salient research related to this topic.
Yeah, good question. So Australia has been really progressive in trying to support their youth on the autism spectrum, and that Australian parenting website, Robin, might actually also be helpful for the parent. They have similar videos and different perspectives of parents who have kiddos on the autism spectrum. But so Australia is up there, as well as the UK. So Robin Stewart, a ton of the studies that I mentioned, like with those statistics in the middle part of my presentation, were pretty much all British researchers. So the UK is looking at this quite a bit, and hopefully, the United States will start getting on that train as well.
Totally makes sense that Australia is pretty progressive. I don't know if y'all have noticed or watched, but Netflix had a show called Autism on the Spectrum, and it was based in Australia, and it talked a lot about like romantic relationships with individuals on the spectrum. So
yeah,
makes sense to me. Yeah.
I saw that video. It's really good. If we don't have any more questions, feel free to put them in the chat. But I had a last poll that I'd like you all to participate in. Let me see. And it's just, what is one thing you learned about today that has really stuck with you? And this is just moving forward informative for me to be able to kind of, if I need to talk more about things, but yeah. So what is one thing you learned about today that has really stuck with you? I'm going to stop sharing. Yeah, lack of research. That's what got me on this path. Yeah, lack of research, gender piece, appropriate and inclusive language. Yeah. Awesome. I'm glad you guys will be taking home some of that inclusive and appropriate language use around menstruation in general, as well as hopefully it's lit a fire under some of you to get out there and support our menstruators on this autism spectrum, and maybe do some more research in the area. So using correct language. Thank you, guys.
Thank you, Keely. That was great. This presentation is recorded and will be posted on the UTTEC Lab website, as long as with the presentation slides. So if you want access to the video and the presentation slides, or if you know somebody who would be interested in watching this video, please feel free to go to u-TTECLAB.com. Again, thank you so much for attending, and hope you have a great Friday.